exciting moment. We'll have Niola for the member spotlight, Niola Cancer Foundation. They were established in 2016 by the executive director, Niola Omoro Akinunde, after the death of her husband from colon cancer. Today we have Esther, who's part of the team, with us to tell us more about the Ijoya project. I think it's just so cool how they used something as fun as dance to raise awareness about CRC and talk about such a heavy topic. Before I run it, let me hand it over to Esther to tell us more.
All right, thank you. Thank you, everyone. So I'm Esther, and I bring greetings from our Executive Director, Niola Cancer. She couldn't make it this night because it's 11 p.m. here in Nigeria. So nearly everyone is asleep already. So we have to talk on Ijoya 5.0. That was the 5th edition. So Ijoya is basically our annual health event, which debuted in 2017 with the objective of promoting healthy lifestyle and basically for CRC awareness, bringing people for screening because people shy away from screening. And here in Nigeria, people love to party, people love to dance, people love partying. So Ijoya was a means of getting people to screen for CRC. So the event basically is getting people to come. Then in the process, we have dance, we have exercise, we have wellness activities, then the screening. But before then, there are a lot of activities that must have gone, getting people to come to pick the bottles for FOBT, sensitization, and all before they come for the event. So the goals, Ijoya was mainly to address the issue of the low level of awareness in Nigeria. There's still a low level of awareness of CRC in Nigeria, and we hope that we will cover that people will get more awareness on CRC to face the challenges of colon cancer in our society. So the creation of awareness is just the basic idea of Ijoya, creation of awareness of risk factors of colorectal cancer, then sensitization of reducing the risk for colorectal cancer, as we are all aware that what we eat contributes majorly to CRC. So we bridge the gap between the providers of organically grown food produce and participants, where we encourage people to eat basically organic foods, not the GMOs and the likes. So the event targets adults from the age of 45, both male and female. Even lower ages are encouraged to come, but by 45 years old, we target adults from those age. And the health equity grants have really helped a lot. The Ijoya 5.0, we got our first equity grant to sponsor that, and it was a great one. It really helped us a lot. So it was, just like I said before, Ijoya 5.0 is to address the limited health literacy, the lack of awareness about colorectal cancer, screening methods, and the limited effects of this management of this cancer. So Ijoya 5.0 has really been impactful. And we had our last Ijoya last month, Ijoya 6.0. We had Ijoya 6.0 last month as we went to a new location actually to create this awareness. So the project objectives, CRC awareness, just like I said earlier, creation of awareness on the risk factors related to colorectal cancer and other cancers, because just like here in Nigeria, people tend to get more attention on breast cancer, prostate cancer. There's little awareness on CRC. So we are trying to cover that gap to get in that space to create more awareness on colorectal cancer. Then for screening, during Ijoya is always a free screening time. Is free. We don't charge people for it. So people come to get their free screening, incentives, then follow-ups and reminder system. Then patient care. After Ijoya, there should be a follow-up where from the FOBT screening, we might get some positives, and the follow-up is to go for colonoscopy. Then patient care, we provide colostomy bags to patients who are indigent already. Then meals, disposables, things they need for their welfare and all. So the implementation always takes this process, the launch of events. So when we set a date, we launch our events, the meeting with the stakeholders. This involves the government, Ministry of Health, every stakeholder that is meant to be involved, community leaders, everyone who is meant to be involved. Then the awareness creation, then we go around door to door, meeting people, creating awareness, social media awareness, and all. Then we have the main event, which is Ijoya. So before the main Ijoya, we've done all these roadworks, meeting with people, encouraging them to come for CRC screening, free screening, and just as we'll be using FOBT for a while, they have to pick up bottles, follow instructions before they can come for the test. So we have to do all those before the Ijoya day. So there are a lot of works going on background, meeting people, talking door to door, markets, and all. So after the main events is where we have the follow-up system and reminder from the results we get, colonoscopy, then follow up, this and that. We ask them what they feel and okay, the outcome for Joya 5.0, we achieved, yes, 65% increase in awareness for colorectal cancer symptoms and risk factors. There were more awareness created. We had that event at Ogudu GRA in Lagos State, and there was a level of increased awareness. We got a relative amount of people to get screened. I think we gave out about 150 bottles of FOBT for screening, but we got only 120 people came back for screening. So that was a good one for us. From 150, we got 120 people coming for screening. So 120 people received the free colorectal cancer screening. We were able to train community health workers to continue the local education within their space, within their communities too. So through the use of social medias too, we're able to reach a larger audience to talk about CRC. So for the FOBT results we had for Ijoya 5.0, we had 120 people participants from the 150 speculated for screening. So each participant received a comprehensive health care, just not the FOBT screening, because here in Nigeria, people like free things. It was accompanied with maybe checking their blood pressure and all those. There were a lot of activities going on with it too. So 16 people tested positive during the FOBT screening. So we were able to sponsor those 16 people for their colonoscopy, and everyone is doing fine for now. So we got 16 people then in 2023 testing positive, and we were glad that we were able to at least make a change in their life, because if they haven't done the test, they wouldn't have known that something was wrong with them, or they would have been treating something else, not knowing that something was actually wrong with them. So the 16 people went for their colonoscopy. So successes and the lessons we learned, meeting people where they are matters. It not necessarily has to be at the clinics, at the hospitals. It can be at their comfort zone, meeting them because we go door to door most times, road walks, we go to markets, we go to schools, we go to religious centers, not just going to clinics or when they're in the clinic. So we meet them at their safe space where they can easily open up to you, where they can talk to you. And we learned that a lot of people, just like we said, there's still a huge gap. People are still not aware of this disease among us. So there's still a huge knowledge gap that people still don't know about colorectal cancer. People miss it for something else, treating pie, treating dysentery, or treating other things. And with the religious belief and the myths around us here, so there's still a huge knowledge gap within in the CRC awareness here in Nigeria. And we hope that we're able to do more in that space as times goes by. Misinformation and stigma. People don't like to talk. They feel cancer shouldn't be their portion the way they say it here. But cancer is not my portion. Cancer is not my portion. So they don't like talking about it. They feel once a year you have cancer, they feel the fear, they are going to die, they are not going to get a cure. So people don't like to talk about it. So there are myths, the religious belief, the cultural belief here in our society is really deep-rooted and it affects the way people say these things. Then screening hesitancy, people avoid screenings due to fear of the unknown. Are they going to test positive? Are they going to test negative? So the fear of the unknown is very common here. People avoid screenings. People avoid screenings a lot. You hear them say, I'm having these symptoms, I'm having that social symptoms. And you tell them, hey, you are to come for screening, then you won't find them again. They get scared, the fear is there, they are just scared of fear of the unknown. Then budget constraints too, with the economic state of our country. We usually have budget shoot up during the actual projects because what we've planned most times when the actualization, when you are trying to carry out the plan, you find out that it doesn't work that way. You have to get more support and all just to meet up with the plan, just to meet up with the events. So from our recommendation, so as behavior changes takes time. So we hope for a sustainable impact from building trust and ongoing dialogue, not just short, not just one-off campaigns. So that's why we try to make it every year, not just one-off campaigns, not just going there, talking to them, and there's no follow-up and there's no continuance of dialogue, not just leaving them hanging. So as behavior takes time, as long as they keep hearing the message, the change of heart will come. They will be willing to come for screening. They will be willing to seek help. And the other thing is CRC awareness must reflect the cultural, linguistic, and social context of the community. Like here in Nigeria, the culture here is diverse, different languages. So you have to be able to fit in any community you are finding yourself. You should be able to fit in with their language, with their culture, and so these are pictures from Ijoya 5.0. This was at Ogudu GRA, people dancing, people exercising, and screening was also ongoing during this event. So Ijoya used to be a fun one, and we're always glad that we get people to come to do this screening free of charge. And even after Ijoya, we have the screening on continuing to, and the screening doesn't stop at Ijoya. The screening continues as long as there's Niola Cancer Care. So the screening doesn't stop as long as you are willing to come forward for your screening. My next slide, I think my next slide is also a picture. Yeah, this was also during the events. People for the screenings were the medical teams during the event at Ogudu GRA. Thank you. Thank you for listening. I hope I hope I was able to pass the message, and we hope to do more in our space here to create more awareness on colorectal cancer, because there's still a huge gap here in Nigeria, and we hope that Niola Cancer Care will be able to fit in that gap, will be able to do more to help people to get screened in Nigeria. Thank you for listening. Really appreciate for having us here. Thank you.